Hi everyone, I'm Dr. Elise Chambers, internal medicine primary care at Lisa Larkin MD and Associates. Preventive medicine is my passion. So every month in our newsletter, we're going to incorporate what I'm going to call the Clinic Minute. Each month we're going to focus on a topic in preventive health care and hopefully help you focus on preventive health a little bit too. So this month we celebrate American Heart Month with the American Heart Association, and February 4th was Go Red for Women. This month, we're just going to focus on heart health and hypertension. High blood pressure or hypertension was the topic of focus this year for the American Heart Association. High blood pressure is a huge risk factor for heart disease and stroke, and it affects 1 in 2 Americans nationwide. And 1 in 4 of those Americans don't even know they have it. High blood pressure affects people of all ages. In fact, 1 out of 4 Americans aged 20 to 44 have high blood pressure, and many of them don't even know it. High blood pressure, long-term for decades, is called the silent killer, and it's a scary thing. We don't even know we have it. We're living with it for decades, and it infers a much higher risk of heart attack and stroke. So what can we do about it? First thing, just make sure every year you make an appointment with your doctor for your annual physical. A thorough history, physical, and exam and analysis of your health, it starts there. Secondly, monitor your blood pressure at home. For many of my patients, even with borderline high blood pressure, home ambulatory blood pressure monitoring is the key to getting on top of the issue and really seeing where your baseline is. If you're interested in doing that, just buy a blood pressure cuff from your local pharmacy. Make sure it's an arm cuff and not a wrist cuff. The wrist cuffs tend to run falsely high at times. Take your blood pressure, at least for 2 weeks, once in the morning and once in the evening, and write down your numbers. Then make an appointment with your doctor. Talk about the blood pressure numbers. For information just in general, if your top number is above 130 consistently and your bottom number is above 80 consistently, you may have hypertension. Talk to them about your family history. But remember, just because you don't have any family members with high blood pressure doesn't mean you can't have it too. So, a few other factors in blood pressure management and reducing your risk for heart attack and stroke down the road. I call it the rule of tens. 2 things, 10 is the easy number to remember. The first is if you're carrying extra weight, losing 10 pounds could impact your blood pressure and maybe even drop your top number by 10 points. That's a huge risk factor reduction over time. Secondly, 10 minutes of exercise a day, especially if you're not doing much right now, can also infer a much lower risk of heart attack and stroke down the road, and can also significantly impact your numbers. The American Heart Association recommends 150 minutes of cardiovascular exercise every week. But if you're not doing anything, don't see that number and get scared or frustrated. Just start with the rule of 10. Walk 10 minutes a day, get up and do some calisthenics for 10 minutes a day, or just simply walk up the steps up and down in your house 10 minutes a day. Small changes, big impact. 10 and 10. Thanks for listening. Celebrate the American Heart Association's Heart Month and make some small steps for a big impact for your health down the road. Take care.